Good evening. My name is Disha. I am going to discuss an RCT. So, the aim of the study is to determine the effectiveness of Theragun in low back pain and ergonomic advice in bus drivers. This particular study was published in International Journal of Science and Research, and this particular journal's impact factor is 7.5. Now, beginning with the introduction, low back pain is a major health issue which is affecting millions of people worldwide, and this particular low back pain has been classified in few factors. For example, mechanical, non-mechanical, and it is having referred pain also. So in this particular study, bus drivers were the target population, and in terms of intervention, vibration therapy was given. Vibration therapy was given in the form of Theragun, which enhances the kinesthetic awareness, it improves the flexibility, and as well as it reduces the pain. Now moving on forward to the methodology. So in methodology, 30 participants were recruited in the study, and in group A, 15 participants were there, and in group B, 15 participants were there. So in group A, ergonomic advice and Theragun was given, and in group B was basically a control group, so no treatment was given in that group. So now moving on further, that what were the inclusion and exclusion criteria. So in inclusion criteria, subacute low back pain individuals were basically included, and the age group was 21 to 60 years old. And the exclusion criteria was basically the individuals who are suffering from RA, AS, sciatica, disc herniation, or traumatic injuries were excluded from the study. So if I talk about the outcome, so basically they were looking for pain and the low back pain disability. So for the pain, they have taken NPRS as an outcome measure, and for the low back pain disability, they have taken Oswestry low back pain index questionnaire. Okay, so this was the whole thing related to the intervention of Theragun. And if I talk about the ergonomic advice, so few advices they have given. So I would like to list down few of the things. For example, use the rear view mirror frequently and keep the knees bent and keep the pillows behind the back. These were the few ergonomic advices given to the bus drivers. Moving on forward to the results. So all the statistical analysis was done in the SPSS version 26, and descriptive analysis was done by using the mean and standard deviation, and post-treatment between the group analysis was done by the PAD-T test, and within group analysis was done with the help of unpad-T test. Now moving on further, that what the results they have found out. So if I talk about pain, significant difference was found, which was 47 in group A, and in group B it was 540. So there was a significant difference. And if I talk about the second outcome, which was Oswestry low back pain index questionnaire, only the mean of 1 was a difference in both the groups. And if I talk about the p-value, it was significant in both of the outcomes, which was less than 0.05. Now moving on towards the discussion. So whatever the results which they have found out from this particular study is in line with the literature which is in there. Okay, so which they are talking about, that there is a reduction in the pain, there is improvement in the flexibility, and also apart from that, the individuals have improved their daily activities, their function has been improved. So this was the whole thing which was there in the literature, which is also matching in with this particular results of the study. Now, moving on forward to the limitations of the study. So, this particular study is having small sample size. We cannot generalize to the whole target population. And last thing is a critical appraisal, and in which I want to highlight two things, which is the strength and the weakness of the study. So strength of the study is basically, this particular study is an RCT. So if I talk about the hierarchy of the evidence, this is the second one, and the first one is the systematic review. So in RCT, we generally randomize the whole thing. So whatever the distribution or the characteristics which we see in the participants get randomized in the whole group, so which is a less chance of bias. Apart from that, they have taken the outcome measure, which is an objective thing rather than the subjective thing. So Oswestry low back disability questionnaire is being taken in the study, which has high reliability as well as high validity. Apart from that, I want to talk about lastly the weaknesses of the study. So there is no blinding in the study, and in the method section they are talking about some intensity which they have signified as 3, 4, 5, and 6, but we don't know what is that exactly. Apart from that, how they have done the random sampling, whether they have used concealed envelopes or not, they have not mentioned it clearly. Apart from that, low back pain is a very broad terminology. There can be various causes of it. There can be sacroiliac joint involvement, there can be claudication, there can be disc herniation, or there can be many other things which can be, the origin of the systemic involvement also. So we have to rule out that thing before we give the intervention. So I think so that should be included in the study. Apart from that, I think that ergonomic advice is not a solution to the low back pain, but it is more related towards the maintenance or the prevention part, but not the solution for the low back pain. So I think so that is it, and this is the end of the video. And if you have any kind of doubts, you can always email us and ask us. Thank you so much. Thank you for your patience.